Are you experiencing lower back pain when you try to do deep breathing or belly bracing? So in this video, I want to share with you some tips to help you fix this problem. Many people would say that when they try to do deep belly breathing to help with lower back pain, they end up actually feeling more lower back pain. So the one thing I want to share here is that you want to look at how you're breathing in terms of if you're using any of the lower back muscles to help you breathe. So we want to be mainly using the diaphragm to breathe, but sometimes because of all of the tightness that's already there, because of some sensitivities in these muscles, when we're breathing, we're using these muscles still to breathe as well. So the first thing I want you to look at is just take a deep breath and see if you are using your lower back muscles to prompt that breath. Notice as you breathe, there's just a slight anterior pelvic tilt as you do that. So as you take your deep breath, you're using these muscles to kind of prompt you forward. So you may notice a little bit of movement in your pelvis. And you can also do this exercise lying down, taking a deep breath and seeing if your lower back moves forward and your back is not all the time on the mat. So that's the first thing to look at, and that would indicate that the paraspinals, the QL, these lower back muscles, they're trying to kick in as you breathe it. So you're using them to breathe. And we always want to go back to finding that sweet spot. So that's kind of the spot where we're relaxing these muscles. So we're able to do certain things like bend over and breathing without engaging them. So you can try here a few different things. You can put your hands here on your lower back, and then you can breathe and see if they engage. You're usually gonna feel a little bit of contraction there. So what you wanna do is you wanna try some different positions here. So what I usually teach in back pain control is that just move forward, bend over, and see at which point these muscles are engaging. You can also move back a little bit, try to relax these muscles until they're fully relaxed, and take a deep breath there. So, and then notice if there is still pain. So you can try bending forward. You can also try bending backward. You can do it on a chair, just kind of leaning back, relaxing these lower back muscles and breathing from your belly and seeing if that still triggers pain. So that's the first thing I would do. If you do notice that it does get better with different positions, either bending forward or bending backward, then you can try some of these stretches to help you release tightness in the paraspinals and the QL area. The other thing that is also very common is that one of the major causes of lower back tension is usually a tight psoas, and I talk about this extensively in this channel. So releasing the psoas with deep tissue releases and stretches really help to restore balance in your hips and pelvis. But many times when the psoas is really tight or overactive, then when we're breathing, we're actually engaging the psoas, which can cause that lower back pain again. And also if we're doing core exercises on the floor and we are using some of that psoas to breathe deeply and engage the inner core, it can cause that pain too. So one thing you can do again is you can try to do the belly breathing exercises sitting down to see if that helps. And you can also do some psoas releases before you do your belly breathing, again, to see if that helps. The goal is to just try these things so we can isolate the issue, so that if these things help, then we know that the cause was a tight psoas. So again, once you have done all of these things, I want you to place your hand on your chest, the other hand on your belly. So I want you to notice if when you're breathing again, if there is any movement at the lower back. So as you breathe in, notice if you're using your lower back to breathe. We don't want to do that. So just try to completely relax your muscles and breathe in. You want to notice that, so you want basically the hand on your belly to be raising up and down, and you want the hand on your chest to be raising the least amount possible. That's when you know that you're breathing from your belly. So again, if as you're experiencing this, you're noticing any issues, try a different position Try it lying down, try it seated down, try it seated with your back leaning backwards to test different positions and see which ones are giving you the least amount of pain or where the pain completely stops. You can also try it lying on your side. So these are all things that I want you to look at. If belly breathing causes you tension in your lower back, because it really shouldn't. And as you're practicing, just make sure to, again, stretch out the paraspinals, the QL, and stretch out the psoas frequently. These are muscles that tend to tighten up very frequently with extended seating, driving, and just stress in general. So make sure to spend some more time there and practice deep belly breathing with your muscles relaxed. If you experience piriformis syndrome, which is that pain in the butt, along with sciatica, I highly recommend that you try some of the exercises in the free piriformis syndrome rehab plan. I have the link below. This is an amazing plan that I'm giving away for free, and it's a complete plan with video tutorial that you can do at home, and it includes some of the best exercises that are specific to piriformis pain.